I'm going to ask our next speaker, Dr. Vanessa Parks of University of Mississippi, to start sharing her screen. She'll be sharing with us about behavioral health after oil spills. And a fun fact about Vanessa, she is, in addition to being a sociologist, she is also a yoga instructor, and she has a 100% success rate for getting people into handstands, even if it means lots of props and assistance. So, all right, you're up, Vanessa.
Thank you so much, Emily, and everybody at Sea Grant for having me. Again, I'm Vanessa Parks, and I'm a researcher at the University of Mississippi. I received my Ph.D. in sociology from LSU, so I'm no stranger to South Louisiana. Today, I'm going to be talking to you about behavioral health after oil spills. And behavioral health is kind of an umbrella term that's used to describe mental health and substance misuse. So I'm going to be talking about a wide range of outcomes. And just a word of caution here, I'm a sociologist, I'm not a psychologist, so I will not be talking to you about your family and friends' individual pathologies, but rather I'll be talking about larger population health issues so that you can get a sense of things that might be happening in your communities, and maybe you see evidence of this in your own life. How do I scroll through to my next slide?
I had to click on my mouse, and that took me a while to figure out as well.
Okay, if you click on the, there you go.
Thanks. So I want to quickly acknowledge that the research that I'll be discussing was made possible by grants from the Gulf of Mexico Research Initiative and the National Science Foundation. In this presentation, I'll start by discussing what we mean when we're talking about disasters from a human perspective and what that means in the context of an oil spill. I'll give an overview of the research findings related to health after the Deepwater Horizon oil spill, and we'll spend some time talking about health and behavior in Louisiana specifically. I'll conclude by summarizing these findings, and this should segue really nicely into Chris and Missy's presentations about community needs. So you've seen this slide a few times now. We're just using it as a way to ground us and to connect all the presentations. So at this point, we've moved all the way to the right into the ecosystem services portion, and we're talking about human impacts. Defining disaster. When you hear a social scientist talking about a disaster, we distinguish between the hazard event, so whether that's a hurricane, an oil spill, an earthquake, that sort of thing, from the disaster, which we understand as an inherently social process. A hazard is the event, and the disaster is what happens to the people who experience the event. It's one of those, if a tree falls in a forest, did anyone hear it sort of situations. There's a nice quote from a piece on Hurricane Katrina about how there's nothing natural about disasters, and who lives and who dies is to a greater or lesser extent a social calculus. Now, the death toll of the Deepwater Horizon is much lower, but we can still understand these impacts in terms of social factors like employment, or the resources that folks had to cope. So in this way, you won't hear me talking about how disasters are great equalizers, which sometimes you'll hear in the news media. In fact, if you glean anything from this presentation, I would want you to come away with remembering that disasters impact some people more than others, and that some people have more resources to cope than others. And I also want to emphasize that even though I'm talking about health in the aggregate sense, I also want to remind us that these impacts manifest in very real ways that maybe won't be captured in the type of survey data that I'm presenting. Many of you may have personal experiences that you may or may not see reflected in these data, but I just want to remind us all that we're talking about real people here, even when we're talking about statistics. So we've all seen this image now. Whenever you go to presentations about the Deepwater Horizon oil spill, you see this same image over and over. We know, thank you so much to our two previous presenters about the effects to the environment, and now we're going to talk about people. The first question you might ask is how oil spills are related to physical health, and how dangerous is it to be around the site of an oil spill? So most of the research in this area has focused on cleanup workers who can experience really acute neurological, so brain, ocular, eyes, respiratory, lungs, and dermal skin symptoms. This research suggests that when folks are involved in cleanup work, the symptoms can be pretty severe, but that over time and as time goes on after their involvement in cleanup work, the symptoms tend to subside. That said, there's actually a very large team studying cleanup workers, the Gulf study, which some of you might be familiar with. Some of their research is starting to come out now, so we will stay tuned to their work to see what they found about the long-term impacts of oil spill cleanup work on physical health. Studies on behavioral health, so mental health and substance misuse, tend to focus on residents. And what this research suggests is that folks who've experienced resource loss, whether that's losing their jobs or losses to income, or even felt strains on their personal relationships, those folks tend to have worse health outcomes. To combat this, we sometimes hear that social capital, or the relationships that are embedded, the resources that are embedded in our personal relationships, might offset these health impacts, but the evidence there is mixed, and we'll come back to that later. So I'm part of a large team of researchers known as the Consortium for Resilient Gulf Communities that was funded through the Gulf of Mexico Research Initiative. It's a partnership between all these entities here on the left. I'm in that photo somewhere. This is us on a helipad, and that's not even all the folks on the team. We were assembled to study the social, health, and economic impacts of the Deepwater Horizon oil spill, and most of the research that I'm going to be talking today stems from the efforts of this team. So as part of this team, we disseminated a telephone survey to residents of the Gulf Coast to see how folks were doing 6 years after the Deepwater Horizon oil spill. And the idea being is that we could hopefully identify vulnerable populations to get an idea of how folks were doing and what could be done to boost resilience for future disasters in the region. We received responses from 2,520 people, so households, which is a lot for a telephone survey. And many of these respondents were in Louisiana. We made sure we had adequate representation of both urban and rural respondents so that we had a clear picture of what was going on throughout the Gulf Coast. It's possible that some of you or someone that you know participated in this survey. We learned that half of residents reported some kind of exposure to the spill. The most common exposure had to do with diet and eating patterns. And if you think about occupations as and industries of employment as potential exposures to the spill, nearly 19% of the sample reported having someone in their household with ties to the oil and gas industries. These were industries that were directly affected by moratoria after the spill. About 11% of respondents said that they had household ties to the tourism industry. So this could be something like, normal tourist businesses that we might think of, but also casinos and potentially restaurants. And about 9% said they had ties to the fishing and seafood industries. So thinking about those different employment sectors, we observed different patterns in health outcomes across these sectors. For example, respondents from fishing households were much more likely to receive a positive depression screening, even when controlling for other demographic factors. So when I say a positive depression screening, this is not a diagnosis of depression. We determined if a respondent met a clinical threshold using some questions that are the same type of questions that you would answer at a doctor's office. And if your score was above a certain threshold, your doctor might say, hey, I have some additional questions for you. I'd like to get to the bottom of this. So we used similar criteria in our survey. And thinking back to what I said about social capital and your relationships having an effect on your health, there's this assumption that social ties are just inherently good for your health. And I think that's true to some extent, but I'm also not convinced that having a robust social network is always going to alleviate stress or encourage healthy coping mechanisms. In fact, there's a lot of research after Hurricane Katrina that indicates that folks with larger social networks tended to be more stressed out because they were worried about their friends and family, or it meant that they were drinking more often. So I set out to test how different elements of social capital, so all these factors on the left here, so social embeddedness, which were the number of community organizations that folks were involved in, trust, the extent to which people trust institutional actors, and social support, which is the number of people who you could rely on for material support, like could they drive you to the doctor, could they give you a place to stay if you needed one, that sort of thing. And so I wanted to see how all these things were related to different health outcomes like depression, anxiety, and alcohol misuse. And not to get too much into the math, but there's a way that you can put all of these factors into the same model using a structural equation modeling approach to see how all these variables are related to each other. And in theory, each of these social capital variables should be related to reductions in these negative health outcomes that we see here. We also might expect that that depression, anxiety, and alcohol misuse would be related to one another. So among folks who moved to the Gulf after the spill, or those who didn't report any exposure to the spill, we saw something really interesting. Social support was actually positively related to alcohol misuse, suggesting that people with larger social networks were actually more likely to engage in unhealthy drinking behavior. We also saw that depression and anxiety were correlated, but that alcohol misuse wasn't correlated with either depression or anxiety. So we see drinking as a kind of social behavior that's separate from mental health issues. However, among folks who were impacted by the Deepwater Horizon oil spill, social support was associated with decreases in symptoms of depression and anxiety. This is what we might expect. And we see that depression and anxiety are correlated, but we also see that depression and alcohol misuse are negatively correlated, again, suggesting that alcohol misuse is somehow different from these other health outcomes. What's also interesting that across these groups, social support is really the factor that seems to matter for health outcomes. Group participation and feelings of trust are certainly important and might certainly be helpful, but when considering the role of social ties and material support within them, it seems like those are the resources that can be most beneficial when a person really needs them. So now we'll consider Louisiana specifically. So these findings were from the Gulf at large. When thinking about those health outcomes mentioned before, Louisiana has what I would consider to be alarmingly high rates of potential alcohol misuse. And I want to be clear and say that this is not a diagnosis of like alcoholism. This is just indicators of potential problem drinking, so frequent drinking or heavy drinking. So it indicates that there is problem drinking in the region, statistically significantly higher than other states in the region, which also have fairly high rates of alcohol misuse. So my recommendation here is to prioritize efforts to reduce problem drinking, particularly in Louisiana. The data presented here actually come from a different team, but still an LSU-based team. These data come from a survey from Plaquemine, Lafourche, and Terrebonne parishes. We asked respondents if the oil spill was keeping them from engaging in their normal routine behaviors, and we were looking and tracking over time how these routine behaviors changed. What we saw is that among those with ties to the fishing industry, so again, fishing, they were significantly more likely to have experienced behavior disruptions, but these disruptions decreased as time went on. So we'll end with that good news that these disruptions and these negative impacts might be decreasing over time. So I want to reiterate that coastal residents experienced significant impacts to their health and well-being in the years after the Deepwater Horizon oil spill. And though they persisted for many years, there's evidence to suggest that these disruptions are decreasing. Also, these impacts vary by geography, employment sector, and disaster experience. And alcohol misuse may be a particular problem in this region. And for those experiencing major oil spill disruption, social support in the form of social ties who can offer you material support may be particularly helpful in alleviating symptoms of depression and anxiety. So with that, I will end. Thank you so much.
Thank you so much for that talk, Vanessa. That was really excellent.